Thank you so much for having us here today, and thank you, Anne, and all of the panelists for the amazing work on this important issue. My name is Jessica Hulsey-Nickel, and I run the Addiction Policy Forum. I have been in this field for a long time, and Addiction Policy Forum came together to really focus on a few key areas. One is to, I'm strangely soft-spoken, just not metaphorically. Just real based. But anyways, we came together for a few reasons. One, to follow the science, to do a better job of translating what we know about this disease, and it is a disease. More specifically, it's a disorder because it's a complicated disease, but a health condition. How do we translate what we know and what we've learned? Because we've made incredible advancements, but we haven't applied them. We have amazing programs that work in rural communities, but can you find them easily? We have better treatments and new medicines that are available to treat the illness, but does everyone know about them? We have resources for families in crisis. Can they find them when they're buried on page 92 of Google? Right? We need to figure out how we translate what we know about this illness so it's no different from cancer or diabetes or Alzheimer's or ALS, or the list goes on, to make sure that we are coming together and following the science instead of myth or bias or misinformation. We also have, unfortunately, a family and patient community that can be taken advantage of. When this illness hits your family, it feels like you're hit by a Mack truck, right? And you don't know where to go for help. You are drowning, you're flying blind, whatever metaphor you want to use, and you're more likely to find information of someone who's going to take advantage of you, promise a cure in Arizona or Florida, and you empty your bank account to save your kid. And at the end of the day, it wasn't the treatment that was useful, necessary, or was going to work. So how do we start changing fundamentally how we help families and communities? This is a family illness, and it hits entire communities, and we need to address that. That's why Addiction Policy Forum came together. We work on a comprehensive response, and we also provide a voice for the families that are at the epicenter of this epidemic. A little bit about that in our network. I'd like to say that when I started APF 4 years ago, I had a genius plan to find 4 million people and build a network, but I wish I found fewer people that needed help. But the reality is we have so many families hurting in this country, and our network grows every single day. Families that are in the midst of this struggle, families that have lost a loved one, parents you saw, Anne played one of our videos that we have as an awareness piece. But we need to remind folks that addiction hits every family in one way. None of us are immune, and it does not discriminate. And we need to move away from the shame, stigma, and bias that sometimes exists, because it really isn't everywhere in every community. And what we've found on some of our on-the-ground work is that it's hitting our rural communities harder for a number of reasons. And so we need to be very specific about the programs that work for all types of communities. And if all we're doing is pushing out urban models and interventions, that is not going to get us towards a solution and a real change for the families and communities hurting. So we have a network of 4 million families. We also have a network of 200 national organizations. I've been around for a long time. This is my 27th year in this field, which I really am going to stop saying because people are going to figure out how old I am. So this might be my last edition of that factoid in there. But I started in prevention. I've worked in the criminal justice field, on Capitol Hill and policy, a short stint in the treatment field, decided that direct service was difficult. But the reality is we need everyone at the table. We can't play whack-a-mole and decide that treatment is the only focus this year and next year it's prevention. This is about bringing everyone together in a coordinated effort to focus and be a team. And the other thing that we need to do is not play whack-a-mole with a substance, right? We have, since I've been around, it was heroin, and then we switched to cocaine, and then it was crack cocaine, and then it was methamphetamines. Then we switched to prescription painkillers, and then heroin, and fentanyl, and carfentanil, and our synthetic opioids that are so dangerous right now, that are laced in so many street drugs. We need to build systems that deal with addiction. We do not have a mono drug use problem in this country. We have a poly drug use problem. People initiate with alcohol and marijuana. And you don't pour alcohol or put the marijuana in a different part of your brain than the opioids are going. So it is the compound effect of the substances that might be prevalent in a community that is going to lead to the issues around substance use disorder. So we need to make sure that we're looking at the big landscape. It changes, but our treatment of this illness does not change. And the other thing I think is incredibly important is to make sure that we keep advancing. This is the only disease that, one, has not had a patient advocacy community. One, our treatment has been external to healthcare. If you have a heart attack, you don't think, oh my gosh, I hope I can find a heart bed. Right? When you are diagnosed with cancer, you are not on page 90 alone. We figure out ways to make sure that the medical treatment of diseases are more available in every other space except for this one, regardless of the amazing advancements that we've made. We already know the problem. Unfortunately, my video is out of date because it's not 144 people that die a day anymore, it's 174. When we first made this awareness campaign, it was 114 a day. The numbers are going in the wrong direction, but I truly believe if we work together, we can bend that line and start bringing these numbers down and saving lives. We have the solutions, we have the science, we have research, we have amazing interventions that exist. It's about taking what we have and putting it into practice. And the real focus right now of Addiction Policy Forum, we want to build the tools that you need and then give them to you for free. That is really what our focus is. We need to make sure that all of these puzzle pieces come together to work on the issue, but then make sure that they are open source resources. We're not going to charge folks for the things that they need for their school system, for their primary care practice, for their emergency department, for their police department, for a farm and a farmer and an employer that wants to start implementing programs to help families in crisis. This is about building the things that we need that are based in science, right? We don't do guesswork on Zika and Ebola, and we're not going to do guesswork on this disease either. So we released late last year a plan. It's a 4-year plan. It's 8 priorities to address addiction in America. We have everything from the need to, and I lead with this because again, and I have very specific reasons for this, we need to help families in crisis. We have 21 million families today that are in crisis because someone that they love has a substance use disorder. 15 of those 20 million are dealing with an alcohol use disorder. It still remains that our #1 abused substance is alcohol. And when you add opioids or marijuana or methamphetamines into that landscape, it makes it an even more treacherous disease. So we need to remember to look at the big landscape. We need to expand treatment, and we need to get politicians and some of us out of the exam rooms and let the treatment program be developed by those that are experts. Driving discovery, we are the only disease that has never raised money for a cure or better treatments, right? We're more likely to fight against each other or sort of get sidetracked on one issue than come together and really demand more medicines and more treatments. I'm incredibly grateful that we have 3 medicines to treat opioid use disorder. We don't have a medicine to treat methamphetamine use disorder. We don't have a medicine to treat benzodiazepine use disorder. So how can we make sure that we keep advancing in the right direction? Recovery support. We need 3 to 5 years of treatment and recovery plan based on the severity of your substance use disorder. It's not 28 days. So we need to follow the science instead of the myths and the misinformation that exists and make sure that we build recovery-ready communities. Sending someone home, recovery is about people, places, and things. So you're going to sort of deal with all those same triggers that you need to manage in your wellness and your recovery plan. So we need to build the programs that help those individuals and those families sustain recovery and find wellness. Prevent addiction. This is 100% preventable disease. Now, most people are going to drink in their lives, right, or even use a substance, but it is the age at which they begin these behaviors that create the risk for developing an addiction. If you start using alcohol and marijuana at 13, you have a 1 in 4 chance of developing a substance use disorder. If you're 41 and you start using alcohol and marijuana, I have a 1 in 25 chance of developing a substance use disorder. So we need to understand that prevention is about delaying the onset, particularly of alcohol and marijuana of our adolescents. And really quickly, protecting children impacted, the child welfare impacts and what happens at home when someone has an addiction is very tough. reframing our criminal justice system to give our law enforcement, our corrections, our courts more tools, and then again, just to advocate and educate, use our voices. We need to bring this illness out of the shadows, and we do that by talking about it. I don't know how much about that. Very quickly, and I have a kind of funny story on the origin of this, and then I'm going to nerd out for 2 seconds, but I promise to be really quick. We just launched something I'm very proud of called the Addiction Resource Center. It is a one-stop portal for evidence-based, real information about the disease of addiction. You can take an assessment for yourself. You can take an assessment for a loved one that you are worried about. It is free. It's addictionresourcecenter.org. It doesn't sell your ticket to the highest bidder, and it is not information that is intended to direct you to any one pathway. This is about creating individualized systems of care for the patients that need help. There's info about, I just copied every other patient disease space that's done great work of educating their community. There's information about what to do after a diagnosis. Because there is a diagnosis, this is a health condition. It's about prevention. It's about understanding the different types of use disorders. All this information is available. There's videos to explain the impact on the brain. We are particularly proud of the 4-minute explainer video we did that explains the brain science. If you have a few minutes and want to nerd out, we need to remind ourselves that heart disease might affect your heart, asthma might affect your lungs, addiction affects your brain, and it is treatable, and we need to understand the impact of the brain to have more empathy for those that are struggling with the illness, but also to better understand how we treat it. So we launched this ARC, and the next phase of this is, and we're mapping resources, that's the other part of this, making sure there's no bad actors. And when you are had that Mack truck hit you at 2 o'clock in the morning and you're worried about your nephew, your spouse, your son, your daughter, that you have the right information, and we don't send you to a website that has dead ends or dead numbers, that you get connected with real resources in your backyard. So we are every day mapping the resources available, one county at a time, until all 3,069, I believe, counties in this country are mapped and available through the ARC. The other piece of this is to launch a crisis line. And this is my funny, I think it's kind of funny, but I'm getting a little heavy here, so let's just have a little bit of a giggle break. But I have 3 sons, and I've called poison control 11 times. Not once, but I've called 11 times. My probably most funny poison control story is when, unfortunately, my youngest bit through one of those glow-in-the-dark sticks, and he had this like yellow glowy stuff that was like all over the front of him and in his mouth, and I'm, you know how we parents can be, I'm nervous, and I'm, oh my gosh, and I can't find the case, oh my, is it toxic? I have to go to the emergency room. And I have maybe more than 11 poison control magnets all over my refrigerator, or in any location in my house that I could possibly use to write. I can't believe I haven't memorized the number after all of my experience. And I call and I talk to this nurse who knows that it's not toxic and calms me down and tells me the 3 times I did have to go to the emergency room and the other 8 times that I didn't, and was there in my time of crisis. And right now, we do not have that person to call at 2 o'clock in the morning when your family's in crisis. And I know this personally. Both of my parents had a heroin use disorder. My mother found recovery through a drug court, and I had many years, 19 years, with her in recovery before I lost her. Still much too early because of the long-term health consequences of substance use that we don't like to talk about. But my dad, that call that I got at 2 o'clock in the morning after years of my dad struggling with an opioid addiction, when he asked me, like, Jessa, I'm ready, I need help, I could not find where to take him. And I worked in this field. I was young, but I was interested and involved. And it was still so hard and so lonely and isolating when we don't have the resources to help families navigate literally the darkest days that they will ever experience. And you're worried every moment that you're going to lose that person you love, and you don't have that person holding your hand. So in April, I think we'll be ready by April, we are launching our pilots to have a crisis line manned by clinicians, master's level social workers, peer recovery support specialists, caseworkers, to make sure that someone picks up the line and the phone, and instead of it being about the glow-in-the-dark stick, it's helping you navigate one of the most deadly diseases that's hitting this country today. And the other thing that we're working on, and then I'm probably running out of time, so I'll be really quick. We need to change the integration of how we treat this disease into healthcare. I want people to find physicians. You may need a treatment center to sort of change your environment, to have a dosage of very intense treatment, but you are going to need much more than that dosage to handle this disease. So we want to figure out how we get the right resources and tools into the hands of our physicians. And this is why this is important for this room and this conference. It is more critical in a rural community to make sure that you are mapping and working with your existing healthcare infrastructure, your doctors, your providers, your physicians, and your nurses. Nurses are a very, very important component in how we treat this disease, particularly in a rural community where you have to drive 2 hours to have a baby. How far do you think you're having to drive to go get a medication-assisted treatment? So I think we need to pay close attention about how we integrate into our healthcare, and instead of blaming, we need to ask our physicians and our healthcare systems what tools and resources they need to be a part of this solution, because they want to be a part of it. So we have been working on a pilot, and one of our pilots is actually in a rural community, and it's one of my most fun things that I've done in the last year. We are building open source protocols after a non-fatal overdose for emergency departments. We are also building the training protocols that are needed for physicians and nurses in those hospitals, as well as all of the tools, the workflow systems for their electronic health records, all of the things that they tell us they need to make sure that they can change and implement policies. Because of the 64,000 people that we lost in 2016 to overdoses, 70% of them had a previous non-fatal overdose. So right now we can identify those Americans that are most at risk for loss, so let's do something about it. The day I was born, my dad overdosed on my birthday. It was not a moment of intervention. It was the beginning of a very difficult, cascading, worsening illness that took his life eventually. So let's change what happens when we find someone in crisis. Let's change what happens when someone has a non-fatal overdose, so they're engaged in the treatment system instead of sort of being pushed out and not, taking advantage of that moment and bringing both the healthcare system and the family into play. And the last thing I want to come back to Dan's comments too. One of our other projects that's available is we are highlighting spotlights, innovative programs in each 6 of the pillars that are happening. Like, I am telling you, amazing things are happening. And when you watch the news or you are listening or working on this issue, it feels scary and depressing, and the numbers and the death and the loss. But there is also shining bright spotlights of hope and engagement and innovation in communities across this country. And we should start replicating those things that are working instead of all of us feeling like we're navigating in the dark. So in each of the 6 pillars, we have more than a dozen programs that we have boiled down into 2 pages, and then we can connect folks to technical assistance and services if you want to implement one of these programs. And even sort of the smarty pants that helped to design these in the first place. This is us being a conduit to make sure that communities, employers, school systems, healthcare systems, when they want to engage and find solutions, that we build on the deck of innovation that already exists in this country instead of starting from scratch. And also to make sure they're not doing dumb stuff, right? We've learned good things, but we've also learned some things that we shouldn't be doing. We have enough science that we don't need to throw spaghetti at the wall to see what sticks. We need to actually be doing things that can have an impact and have an impact immediately. One of our basic principles at APF is to work with a sense of urgency every single day of the year, because we lose far too many people. And a few things I mentioned, Dan, is that some of our best programs that exist are employer-based, right? There's 2 main parts of the brain that are impacted by addiction. Your prefrontal cortex, all the decision making, and then your limbic system, particularly if you have a severe substance use disorder. That's the animal part of your brain where survival instincts exist. And some of the programs that the employers have managed, they do a good job of actually engaging that limbic system, that reward center, because you can have sanctions and rewards because you're an employer. It's called contingency management. And 2 of the most effective treatment programs in this country are employer-based. One for the physicians, physicians and one for the airline pilots. So let's make it a third one, the program that the farmers built. Right? Because we need to make sure that we don't wait for this illness to worsen, that it's our family systems and our employers that engage before this illness gets worse and takes a life. So I won't go through all of our different spotlights. It is available on our website, and all of our information is open source. We also are launching state chapters to push out free of charge and in sort of this open source format all of our resources. These are the 10 states we are in now, but our goal by Christmas this year is to be in all 50 states. And this is a sincere, honest, always available if you need resources or help in figuring out what the best response for your community. We are here to help you guide you through that process and make sure we connect you to the right information. Thanks again for taking time for us.